My name's Nadine and I was born with a congenital heart defect. When I was born, my parents knew that I had a bicuspid aortic valve, so I was pretty active, kept active, and it really didn't have a huge impact on my youth until I was in my early 20s. The GP who recommended I should see a cardiologist because I had a heart murmur and thought it needed further investigation. It was actually during a nursing prac that I had an ECG done because we were learning how to do ECGs that it actually came up with some abnormalities, and that prompted me to think I should really follow up on that referral from my GP to see a cardiologist and really get a baseline. When I found out that I needed surgery and I had a congenital heart condition that hadn't been diagnosed, it was pretty shocking. I was 21 and I was just kind of starting my new grad program as a nurse. Life was pretty good. The thought of surgery was pretty frightening, but it was, quite scary about what that would mean for future work. Would it mean I could continue exercising? What did it mean long term? It took a little while to feel like I could trust my body again, to feel like everything was gonna, hold together. But I had a really good cardiologist who was really, affirming, and I had good family support. When I went to my cardiologist, I was actually over 20 weeks pregnant with my son. I didn't find out myself till I was 20 weeks pregnant. It was a really big surprise. It gave me a little smack on the knuckles. You're always meant to, plan these things with your cardiologist. Lots of support again from her through that pregnancy. Extra checks on your heart to see how things are functioning and if it's handling the extra load that pregnancy can put on your heart. Even though I'm not the best example, and the first time I did turn up more than 20 weeks pregnant, my cardiologist talked a lot with my obstetrician about how to plan for the birth. Was there anything I needed? And I did require some antibiotics during the delivery process. I wasn't for prolonged pushing. Lots of different things that you kind of don't think of when you've got this heart disease. It's really important to seek that medical advice from cardiologist, and they can then coordinate with your obstetrician or your midwife. It's really important for your own health during that pregnancy time. We generally put our family first, and we don't seek those referrals, and we don't make the time for ourselves, and it's really important to do that because a lot of this is a silent disease, and just taking that time to get a regular checkup and heart check is really important. I had my surgery in 2002, so it's 14 years ago. I'm living a really healthy and happy life at the moment. I have a dilated aortic root, so I now only am allowed to do moderate exercise. With having two active young kids and an active husband, have to modify a few of those daily routines.